Hi, I'm Dr Jade. I'm one of the chiropractors here at First Choice Chiropractic, and today I'm going to show you how to use your cervical Denneroll. Now there's three things that I go through with my patients to help them understand how to do it correctly at home. So number one is the placement, so where that Denneroll is going to sit on your spine. Number two, how long you spend on it. And number three, how you come off it safely. So number one, the placement. With the cervical spine one, it's quite easy. All you need to find is this landmark here. So there's usually, for most people, a bit of a lump at the base of the neck. So we want to locate that lump roughly and place the top of the Denneroll, which is this pointy part here, just below that lump. If you're not sure, you can always put it down a little bit lower, that's fine. Usually for the cervical Denneroll, we don't want it too high up because it's not going to give that stretch back for the neck and that correction of that curve. So I've got Dr. Robbie here helping me demonstrate how you use the cervical Denneroll and get the placement correct. So first up with the placement, again, we want to make sure we're locating that lump at the base of our neck and aligning it just below with the point of the Denneroll. The other thing to be aware of is the direction that this sits in. So this little curve here, that's where our shoulders are going to go. It does say shoulders this side on your Denneroll, so if you forget, you can always use that as a reminder. Now, how we pop it in ourselves, I often find the easiest way is if you're sitting upright first, and then that way when you pop your Denneroll behind you, you can make sure that it's facing the right way. So we can just pop it anywhere behind us and then slowly come back over that point, which it's going to move anyway, but that's okay because we can shift it around a little bit. And then just let your head fall back over that point nice and gently. And hopefully if you can see it all right here, the point is right underneath where that lump is on Dr. Robbie here. So this is perfect placement. Then you can just let your body relax out nice and straight. If your back is starting to feel a bit sore, you can bend your legs up a little bit just to take a bit of pressure off. And then if you're feeling comfy to straighten them back out again, you totally can as well. So whatever's better for you. But also making sure that we let the head come back over that point nice and slowly. Often there will be a bit of distance between the back of the head and the floor, and that's the point. We want to make sure that that weight of the head can actually pull that neck back down. If the head's touching the ground, we can always elevate the Denneroll a little bit, putting a book or something under there just to give the neck a little bit more room to stretch back over. So we've got our placement correct now. Now we're going to talk about the timing. So usually most Dennerolls will aim about 10 to 15 minutes on it. So it's quite a period of time that we need to allow that joint, the ligament to pull back over this stretch. So we actually start more at the 3-minute mark to build up to that 10 to 15 minutes because it is quite a long time to lie in a very compromised position. So 3 minutes on the first day, you can do it at whatever time of the day you like. Once a day is totally fine. We find a lot of patients prefer to do this at the end of the day when they've already been stuck at the desk and they want a nice stretch back and also relax before bed. So 3 minutes to start with, and then every day after that we can roughly add 1 minute until we get to that 10 to 15 minute mark, and we give that time frame of 10 to 15 minutes because everyone's different. So some people might be really struggling with this, feeling very, very uncomfortable on it and only just making it to 10 minutes, and then we have others that find it really easy and 15 minutes is no problem. So just do whatever feels best for you guys. Now the last point, which is coming off it safely, this one's very important, especially for the cervical Denneroll. Again, the neck's in a very compromised position, so if we just sat straight back up and went off and about our day, that could make our neck feel very, very uncomfortable. So what we want to do is actually give the neck a bit of time for all those stretch tissues to come back together, and that's done by taking the Denneroll out and lying there for a little bit of time to, again, allow those tissues to come back together. So we're going to roll gently and try and keep our head down, not lift it too far up, push it out of the way, and then lie back down and keep the head exactly where it was touching the floor. You could be here for 30 seconds, you could be here for up to a minute. It really depends on how you're feeling. And then after that, a good habit to get up and about your day is to roll, push yourself up, and off you go again.